Welcome back to ZPTV. I'm Tim, here today with Dr. Andrew Shapiro, who is a podiatrist practicing out of Valley Stream. Thanks for joining us today, Dr. Shapiro.
Thank you, Tim.
So today we're going to be covering diabetes and how it affects the diabetic foot, because April is Foot Health Awareness Month. So we've been getting a lot of podiatrists and other specialists to answer a lot of questions that we've been getting from different patients. So my first main question is, so why would a diabetic have such problems with their feet?
Thank you, Tim. A lot of the problems occur from three areas. One is vascular disease, and diabetics do suffer from vascular disease more than the regular population. That results in poor circulation and less oxygen to the foot, and that can result in conditions that may cause an infection and the inability of an infection to heal. The other condition is something called diabetic neuropathy. And that's the inability to feel, a lack of sensation, and sometimes a complete loss of sensation.
Oh, wow. Okay.
You know, people think, oh, doesn't hurt, great, but pain tells us something is wrong.
Wow.
So if there's something in the shoe, like a pebble or a piece of glass, and the patient doesn't feel it, that can lead to problems. And the third area is the inability to heal. So diabetics heal at a lower rate. So if there is an infection, then it's more difficult to heal.
Are there any other risk factors that we should be aware of besides that?
There are things like poor glucose control,
Okay.
Elevated glucose, obesity, patients who smoke, certain foot deformities. So if a patient has a bony area, bony prominence, that could lead to skin breakdown, and improper shoes sometimes results in problems.
Okay, it's good to keep an eye on that. So let me ask you, are there any serious complications that a diabetic might have to deal with?
The biggest fear of any diabetic patient is developing a wound, which can sometimes lead to an infection, can sometimes lead to amputation. And wounds are prevalent in the diabetic population. 15% of diabetic patients or diabetic population will develop an ulcer on their foot in their lifetime. The problem with that is it's an opening of the skin. It can lead to an infection. It can lead to hospitalization, and sometimes leads to amputation. And those are very difficult cases.
Now, with your patients on a day-to-day basis, what type of things do you discuss to help to be preventatives, to help prevent some of these problems that might occur down the line?
We always talk about the team approach. So the team is myself, the team is the patient, and the team is other healthcare providers, like their primary care physician, the vascular doctor, their endocrinologist. But the patient is also part of the team. They need to have a stake in the game, and they need to understand that they have to keep their glucose under control. They need to wear proper shoes. They can't do bathroom surgery on their own. They have to take their medications. They have to inspect their feet daily, and they have to cooperate. They're part of the team.
Well, thank you, Dr. Shapiro, for sharing these health tips with us. Remember, April is Foot Health Awareness Month, so if you have any questions about foot health, please go on our website and check out the latest in MRI and different imaging modalities that might help you diagnose any conditions in the future. Thanks again, Dr. Shapiro.
Thank you.
And check out this next clip from the 60s.